Hi, I'm Colin Hung with Healthcare IT Today, and I'm here with Lisa Esch, SVP of Strategy and Innovation in Healthcare at NTT DATA.
Yes.
Lisa, welcome back to the program.
Thank you, Colin. It's great to see you.
It is great to see you here at ViVE 2023. I love
Yes.
having you on the program.
Thank you.
Thanks for coming over. I'm really intrigued by this survey that you've put together that's telling us a little bit of an interesting story with regard to care at home. I know here we've got lots of technology that can solve this problem, but it sounds like your survey has revealed that we've got an awareness problem and a process problem.
We do. We surveyed and talked to over 1,000 consumers at home that consume healthcare. And what we found is the majority of them really weren't even aware, over 52% weren't even aware that they had options to get care at home.
Really?
And so there's an awareness piece there. And when we also talked to them, it was interesting to see how many of them prefer telehealth over in-site visits. The statistics were pretty interesting. 47% still say they prefer telehealth and online visits when they can, and 25% wanted even access to having physician care in the home. So they were open to having a physician come to their home and deliver care, which that's an interesting statistics that we probably wouldn't have seen a couple years ago. And on top of that, there were really only 28% of the participants who on the survey who were not interested at all in any kind of digital care, online telemedicine.
Still want to come in for the visit.
Still want to come in for the visit and see their physician.
It's interesting that first of all, that there's sort of this preference, right?
Yeah.
But you were saying to me before that the survey also revealed that people weren't even aware of the home care options a lot of the time.
They weren't, and I think what we're seeing right now with our customers and with providers is the disruption in the primary care. So people are now seeking primary care at their pharmacy, in Best Buy and Walmart. It's pretty disruptive, and so they're thinking about those kinds of things for ease of access. It's quick. I may not have the same provider I had last year, but now we have other ways to access care and have it delivered at home. And people are open to that and learning more about it. And I think that's what we're going to see, some really transition in primary care.
Yeah, I think to me, what this survey, what your work is highlighting is that, we've got some technology, we've made the investments, but now we also need to, as an industry, make some investments in the process to make patients aware, maybe as part of the discharge process, that say, hey, there's some care at home options. Also, from a marketing standpoint, just to make people aware that the hospitals are offering this kind of a program.
Yeah, and care at home can mean a lot of different things. It can mean physical therapy in the home, occupational, some of the normal services types, things that surround maybe post-op discharge. And post-acute care is more common to have in the home. What we're seeing and talking to our customers about is acute care delivered at home for very specific use cases and diagnoses, that when they show up in the ER, the bed they're discharged to instead of on the 7th floor is the bed in their home. And all of the orchestration that needs to come around that. And we've got the capability to help with that orchestration level, depending on where an organization is with staffing, with process, with people, with services. Most organizations are thinking about this and putting those places in together, but it's the orchestration of what that experience needs to be at home that's the challenge. And that's what we're most excited about.
Lisa, it's always great to have you on the program. Where can people go to find more information about NTT Data?
NTTData.com.
Amazing. Lisa, thanks for being here.
You're welcome.
This has been Colin Hung with Healthcare IT Today. Thanks for watching.
All right.